My name is Cy Frank. I'm an orthopedic surgeon, professor of orthopedic surgery at the University of Calgary, and I'm the co-leader of the osteoarthritis team that is supported by AIHS. Osteoarthritis is a terrible progressive disease of joints that causes increasing pain, swelling, disability, loss of function that can become disabling over a lifetime to where people can't work and can't play and can't function. Osteoarthritis is an enormous impact on our society, actually, in many ways, both direct and indirect costs of about $17 billion a year in Canada of indirect costs and another 10 indirect costs. So if you bring that down to Alberta, that's between $2 and $3 billion a year of cost. In Alberta, there are some 450,000 people right now with osteoarthritis of different degrees, 4.5 million Canadians. So, and it's getting worse. And if we don't do something about it now, it's going to break the bank in 10 or 20 years from now. I'm extremely frustrated with what we have now. It feels like we're living in the Stone Age of treating people with pills that suppress their symptoms and don't treat the disease. And if I were a patient, I would think somebody better be trying to fix this.
Hi, my name is Judy. I live in Calgary. I've had, between both my legs, 7 ACL reconstructions, and have benefited from the expertise of Dr. Frank. Basically, the major problem has been my anterior cruciate ligament, which of course is your stability and support. And due to some injuries through sports, I've had to have 4 ACL reconstructions done on my left leg and 3 reconstructions on my right leg, mainly due to sports, but there possibly is a genetic component that has caused some of the injury or weakness in my ligaments per se. So it's been a long-term process since 1985 between both of my legs.
Well, Judy is a model patient who has done a lot to help herself, and I'm happy to say that Judy at this point only has minimal osteoarthritis despite her number of surgeries that she's had. The surgeries have been, I would say, fairly successful at helping to prevent the progression of the disease in her, which was our goal, to keep her from continually hurting herself and eroding the cartilage that leads to the disability. And at this point, it's been moderately successful. I personally still believe that the surgery is fairly barbaric that we're doing, that is disabling and painful and giving people pain and disability short term. We should have better solutions than that, where we can diagnose and treat things a lot less invasively and never have to do big operations on people. I'm a big believer that the sum of the parts is more than the parts. You know, by getting people together, you achieve synergies and things that wouldn't have happened otherwise. So I've been a big team person my whole life. So this opportunity to apply for a team was fantastic. I think it's the right thing to do to bring people together around this big problem that we've been talking about of osteoarthritis, and to get all of their collective expertise focused on different solutions to this problem.
I'm Lauren Beaupre. I'm an associate professor with a joint appointment at the University of Alberta in the faculties of rehabilitation medicine and the faculty of medicine and dentistry. The primary research that I'm involved in here with the team grant is looking at how outcomes are after joint arthroplasty. So people who have total hips, total knees, how do they recover? How can we improve how they do after they've had joint arthroplasty? And then also looking at people now who've actually had joint arthroplasty and now they've actually come to a phase where the joint arthroplasty is now failing them and they're going to have to undergo a second surgery or a redo or a revision to have a second joint arthroplasty put in. And this is a disease that really so far has in a way defeated the medical community. People come to their doctors all the time with complaints from osteoarthritis, the primary being pain and then how it limits their function. And this is something we all get as we get older. We're all going to get arthritis in some degree, which it's going to bother all of us to some degree. Some people are debilitated by their arthritis. Other people will be able to live with the occasional Tylenol and be able to manage very well. But we don't actually have anything right now that stops the progression of osteoarthritis. We have symptom management. And so, I mean, ideally, obviously, we would like the bench people to start to find some actual parameters that we should be focusing on that actually have an effect on the disease itself.
I'm David Hart. I'm a member of the Alberta Osteo Arthritis Team Grant and a scientist in the McKeag Institute for Bone and Joint Health. Our research, which involves a whole subset of people and is a team within a team, focuses on using adult stem cells from the joint, particularly the knee joint, to repair cartilage and other joint structures, tissues that may be damaged from injury or age or accidents. We do know that not all stem cells or precursor cells are the same. So if we compare the stem cells that we get out of a knee to stem cells that we get out of the bone marrow, the stem cells out of the bone marrow seem to want to go to become bone-like cells, but the ones in the knee seem to favor becoming cartilage. If you think that stem cells or progenitor cells are located where they will do the most good, then bone marrow cells may help repair fractures, but cells in the knee may be designed to affect some cartilage repair. I would say in the next 5 to 10 years, we will be able to repair certain kinds of defects. I think that as we understand more about the stem cells, know more about why certain stem cells may be better than others, and how to differentiate them into an effective tissue will be a reality.
Well, we're excited about Pfizer's involvement, not just from the financial perspective of them matching some of the funding and getting engaged with a couple of our projects. We're excited about their potential to become longer-term partners to help us translate the knowledge that comes out of these two projects that they're supporting into some beneficial things that are actually going to help people.
Osteoarthritis, as we all know, it is extremely complex and is facing many Canadians. It's clearly a very important medical issue to tackle. As we know it, it's impossible to try to resolve complex medical issues if you don't bring around the issue a large team of researchers representing all aspects of research. In this case, starting from biologists and bioengineering, all the way to social workers and health economists. I think that the team that has been brought together by Dr. Cy Frank is second to none. Alberta has a strong tradition of research in the field of rheumatology and osteoarthritis. It's a unique opportunity for Alberta and Canada overall to take leadership in a critical medical area. And I think it's a fantastic opportunity for Pfizer to be associated to such a project.